Welcome to Expert Insight for the first 2021 presentation to you. And today I'm talking with Elizabeth Aylward, who is a certified trainer in the Early Start Denver model and leads our work around the Early Start Denver model here at Early Start at the University of Wollongong. Hi Liz.
Hi Leanne.
So what we might start with is clearing up the name. So Early Start Denver model is not actually a program that was started here at Early Start. Can you tell us how it started?
The Early Start Denver model was developed about 15 years ago by Sally Rogers and Geraldine Dawson, professors Sally Rogers and Geraldine Dawson at the University of California, Davis Mind Institute. And the Mind Institute is the Medical Institute for Neurodevelopmental Disorders, which was established philanthropically by parents of children with autism at that university.
And what was the drive to establish it? Well, what was the identified need?
The identified need came out of the previous model that they had developed, which was the Denver model. And they weren't able to acquire enough rigorous research evidence from the Denver model. So they added components of applied behaviour analysis and pivotal response training to the original Denver model, and then that became the Early Start Denver model. And it's designed for children between 12 months and 60 months of age.
Okay, so we'll go to the research a bit later, but what I'd like to start with is hearing about what are the elements of the Early Start Denver model? What makes it up? What is it?
It's very much, it's a naturalistic developmental behavioural intervention. So that's an NDBI, which is the current very popular form of intervention because of its naturalistic components and because of its fusion of developmental psychology and behavioural analysis. It is very much focused on bringing the child with autism back into the social loop at every opportunity and redirecting the child's focus from objects and unusual details in the environment back to people, to our faces, to our voices, to our actions, because this is how typically developing children do all of their early learning.
So what's so important about, you talk about the social loop. So what do you mean by the social loop there?
So the social loop is how typically developing children do all of their learning in the early years through observational learning because they're so intensely interested in people. So they could be sitting, we could have a typically developing 2-year-old sitting right here in this room, and they would be focused on us and everything that we were doing, how we were sitting, our facial expressions, the way that we're interacting with each other. They would even work out whether we liked each other or not, the way we're holding our pen and the fact that we're writing with it, the words that we're using, the gestures that we're using, and they would be mentally rehearsing those things the whole 5 minutes that they were sitting here with us, or they would be physically practicing them. Whereas if we brought a child with ASD into the same space for the same 5 minutes, pre-quality intervention, they wouldn't be attending to us. They would be more focused on the objects in the environment or unusual details in the environment. So in that same 5-minute period, they would be missing out on all of those learning opportunities that their typically developing peer is getting just by observing people. And this has a cascading impact on their whole of development.
So just then to return to that, I hear part of what you're saying there. What's the problem with focusing on other things in the environment apart from the social interactions and the human element?
It prevents them learning at the same rate that their typically developing peers are learning, and because they're not focusing on the social elements of the environment, those synapses in their brain that are linking those social and communication areas of the brain are becoming weak instead of strong, because the more a child uses their synapses, the stronger it becomes. So this is the wonderful thing about, the first 3 years of life in particular, and then the first 5 years of life, and even up to the first 8 years of life, the level of neuroplasticity in the child's brain enables people around them to reshape the circuitry of the brain because it is actually the early experiences that shape the circuitry of the child's brain, even though the child's genes have set the stage for their learning and development. It's those early experiences that they are getting from the people around them, and the interactions from those people, especially if there's, positive affect involved, that is shaping the circuitry of their brain.
So there are 13 principles, and I won't go to that what ESDM is made up of in terms of training and things. Let's go to the principles first. Now, there are 13, so it's quite a lot. But can we hear about those 13 principles?
Sure. So the first principle is about management of child attention. But this is not just management of the child's attention to the activity or the game that we're playing. It's about getting an attentional distribution between the activity and the game we're playing and our faces, voices and actions. So we're continually wanting that alternating attention, or that triangle of attention between what we're doing with the child and everything that we're doing with our face, our voice and our actions. The second principle is the ABCs of learning, so the antecedent, behaviour, consequence chains. This is very much part of the other two programs that were brought into play with the Early Start Denver model, and delivering very clear antecedents to the child after you've managed their attention, eliciting that behaviour from the child, and then as soon as you've elicited the behaviour, delivering a beautiful, natural, contingent consequence. So this is a model about intrinsic reinforcement rather than extrinsic reinforcement. And the reinforcement that we're trying to build in the child is that social reward factor. And they learn very quickly that we are worth attending to and that we're actually fun to be with. And the third principle is the instructional techniques that allow us to embed those antecedent behaviour consequence chains in our teaching. There are 5 instructional techniques. The one that I will talk about is the prompting, because this is a different type of prompting in the ESDM than in other models, because it's a least to most hierarchy of prompts. So you start with the absolute least prompt in the hope that the child will be able to respond to that. And if they can't, then you will go up a little tiny step to the next prompt. But you would go up through a hierarchy of 3 to 5 steps before you would go to the full prompt, which may be, physically supporting the child to draw a circle with a pencil or to sit in a chair. Whereas other models use a most to least hierarchy of prompting, which doesn't encourage the level of independence that this model does. And it doesn't either optimise the motivation as much as this model does, because it can be very demotivating for a child to, if they can do something and the person working with them is assuming they can't, so going straight to a full prompt, whereas this is quite the opposite. The fourth principle is about modulation of child arousal. And this is a very important principle in terms of preventing unwanted behaviours in children, and also in terms of preventing those stereotypical behaviours and repetitive behaviours that some children with ASD can focus on. We modulate a child's arousal by modulating our own. So if their arousal goes up, they get loud, they start running around, or they get highly active, or they start yelling, then we will bring ours down to the lowest, slowest, quietest level, and they will come down with us. And then we will, bring them back to an optimal level of arousal, because children need to be in that optimal level of arousal for learning. And by us doing that consistently, children then learn to regulate their own arousal. The fifth principle is managing unwanted behaviours, and these are mainly prevented. There's not a specific focus on the actual behaviour in the ESDM. The focus is around building up the child's repertoire of skills across all areas, all domains, particularly in the communication and social domains, so that the behaviour is no longer necessary. So that's the major focus in the ESDM, but also the use of functional behaviour analysis in the event of behaviour not being able to be managed so easily and quickly. Then we move on to dyadic engagement. This is a lovely part of the model where if you imagine an old-fashioned set of scales, that there should be a complete, beautiful balance of coordinated attention between the child and the adult, and lead.
So the dyadic is the two, is it?
Yes, dyadic, two people. So that the adult isn't in control and the child isn't neither in control, but they both take the lead, they both take the follow, and they're sharing of gaze, sharing of smiles, sharing of turns, sharing of materials. So that is something that we need to maintain right through every activity that we're doing with the child, or every routine task. Optimizing child motivation, it's a very strong component of the ESDM to be optimizing child motivation for learning, and there are several strategies we use for that. One is the intrinsic reinforcers and the use of the this then that, pre-MAC principle, choosing activities well, allowing the child to make choices of their own activity, and creating interesting, things, elaborations, variations within that activity, closing down the activity before the child becomes bored or repetitive, and transitioning onto something else. Positive affect needs to permeate this program because of the...
Is this a principle now? So what number is this one?
I wasn't counting. I will get to the end.
Okay.
They're lettered, they're not numbered.
Oh, right. Oh, okay. Okay. That's all right, you don't need to.
Adult optimizing positive affect. So that is those highly affective engagements, so that the child wants to look at us and wants to attend to us because we're worth attending to. So we never need to tell a child to look at us or any of that sort of message. We just use our voice, our facial expressions, our actions, our sound effects, and we bring everything that we're doing to life. And the affect needs to be positive, it needs to be rich, it needs to be genuine and natural and permeate the activity. Then the whole of the ESDM is delivered within the framework of a 4-part joint activity routine. And the very important part of that 4-part joint activity routine is called the setup phase, the first part. And in that first part, instead of doing what an adult might tend to do and jump in and take over and start teaching, you're actually sitting there, you're watching what the child is doing, you're commenting what they're doing, you're imitating what they're doing. And by doing that, you're able to identify their spotlight of attention within this activity, which is likely to be completely different to what ours is.
Yes.
So this is another motivational strategy. If we can identify this spotlight of activity, then we can jump in and take up centre stage, and then start our theme and teaching phase, but maintaining that dyadic engagement throughout. Adult language is another important principle. We use a 1-up rule in the ESDM. So if the child is non-verbal, we would only be using 1 word or a short phrase where appropriate or necessary. If the child has 1 word, we could be using 2 to 3 words, instead of talking in those long sentences or paragraphs to a child, and not giving them the opportunity to comprehend that and respond. And then the final teaching principle is transitions, ensuring that those transitions are smooth, that they don't trigger behaviours, which is a common feature of transitions, that we're able to maintain the child's motivational shift between one activity to the next, and that we do that with great care, so that we, allow a child to stay motivated, to make choices of the next activity before they transition into it. And this is very helpful to the child, and it's very helpful for them to learn that one thing closes down before another thing opens up as well.
Okay. So I'm not going to oversimplify this, but it seems to me it's a scaffolding of social behaviours and socialisation that then allows a child to orient themselves to the world. And I'm assuming this is kind of where
exactly. It's very much about promoting, encouraging, eliciting those spontaneous initiations from the child, which is one of the reasons for the least to most prompting. It's one of the reasons for the high level of affect that we're using, and the reason for the level of repetition that we're using, because if a child knows what a routine looks like, because of the level of repetition you've used, they're far more able to participate in it and show their initiations when you sit back and let them take the lead and pause for a moment.
What I like about what you're saying here too is, if I think about another theoretical lens, I'm not going to use the theory, but it's a stirring into practices, or almost an initiation into practices for both the child and the adult in the circumstances. So it's a learning side by side as well, isn't it?
Very much.
So these are the practices that you're talking about, and ESDM has a number of sort of layers for parents and for educators that are elements of ESDM, the Early Start Denver model. Can you tell us first about the advanced workshop? We'll start at that one, and if you can tell us about what's involved in the advanced workshop, who that's for, and what people could expect from that training.
Okay, so the advanced workshop, also developed by Sally Rogers, Geraldine Dawson, Laurie Bismara, is for professionals working in the fields of allied health, early childhood education, medicine, psychiatry, and those professionals who are working with young children with ASD. So it has the prerequisite degrees to enable people to join into that course, and they begin that course now with a one-day introductory workshop that they do online through the Mind Institute UC Davis, and then they attend a 3-day workshop with a certified trainer somewhere in the world. Currently, we're delivering that remotely. And we've been delivering it remotely from here at UOW since last June. And it's highly effective in that remote delivery, because instead of 3 condensed days, where a child comes into the workshop twice each day and they get to work with that child with some, live coaching, they're able to go back to their workplace between each of the 6 sessions, which are spread across 6 weeks, and practice with their own children in their own workplace. And reflect on what they've learned and try it out, and then bring a little video clip back to each session. So it's working very successfully, to the extent that people are approaching a level of fidelity to the model by the last session of these remote delivery workshops. So that level of fidelity is another important part of the model. The teaching principles, how we implement the model. The other half of the model is the data. It's a data-driven model. So every child is assessed on entry to the program using the ESDM curriculum checklist, and then the child's treatment plan or program is derived directly from that assessment. So that enables us to know exactly where to start teaching the child.
And these things are things that would all be learned in the advanced workshop.
And these are all things that are learned in the advanced workshop. So they learn how to assess the child. They learn how to develop their treatment plan, how to break it down into a task analysis, and then how to collect data against it, so that at any moment of any day, you know exactly how a child is tracking according to their goals across each quarter. Then the third component that we dive deep into in the advanced workshop is the fidelity measure. And this is a very unique component of the Early Start Denver model, ensuring that we're delivering this model in the way that it was meant to be delivered. And the fidelity is something that we score against the way they've developed the treatment plan, completed the assessment, collated the data, and then the way they're delivering those 13 teaching principles in a live session.
And people submit a video of themselves working with children, which is then coded and assessed to consider the fidelity they have reached. There's quite a deal of integrity to the model, in that they must reach a particular level of fidelity in order to be certified, is that right?
That's right. They must reach a level of fidelity at over 80%
using
in
the principles.
every activity, using those principles and in their data. To be able to become certified.
Okay. And that's the advanced workshop. And so that one is one that you've been delivering online, even in other languages via lovely technology that does a synchronous translation. So that's something that was fantastic that came out of COVID, was now opening up this opportunity to people in even the most remote regions, and they can do this work. The other parts of the ESDM offering are an educator workshop, which is a different kind of workshop to the advanced. Can you tell me about that one?
Yeah, so the educator workshop came out of was part of a 3-year research study into whether or not we could apply this model, this evidence-based model of intervention to mainstream preschools and long daycare settings. In order to do that, we had to train all of the staff in those settings, but the only staff in those settings who could do the advanced training were the degree qualified directors and teachers. So we developed another layer of training for all of those staff who have diplomas and certificates in early childhood, so that they could also be trained in the principles of the model and carry that out under the supervision of the certified staff on their team. That's been a very popular model of training because children with ASD are included in so many preschools and childcare centres now, which is wonderful that they're having those opportunities to learn alongside their typically developing peers. But to enable that to happen, the staff need specialist skills. They need to learn how to engage these children, how to teach them, how to maximise their participation in the program to the same level that their peers are, and also how to understand and manage their behaviours, which is actually the biggest barrier to their inclusion. So because one of the research studies we did was on, back in 2014, was on does the ESDM reduce maladaptive behaviour in children with ASD, and the result of that study was that it did to a statistically significant extent. So we thought, okay, if this model does this in reducing maladaptive behaviour in children with ASD, and maladaptive behaviour is the biggest barrier to their inclusion in community settings, then if we train the staff in the community settings in this model, are we removing that barrier? And the research study showed that we certainly did remove that barrier, and not only that, but it built the confidence of the staff. It removed the stress and anxiety that surrounds unwanted behaviours. And so we're now rolling that out to mainstream educators across New South Wales.
Again, online. We've got the online facility. And also I think what we're seeing is teams of educators coming together to do this training together, which is fantastic, because then they can share their practice, can't they, and be collaborative in the sense of their learning as well.
And that's the best delivery model, if you could deliver it to an entire team. And again, that's spread over 6 weeks, so they're getting a week between each session to go back to their workplace and try things out and come back and report on those and troubleshoot, problem solve, share their successes, share their little video clips, and that's been a really lovely training process.
Wonderful. So that's practice in early childhood settings or in therapy situations. What about for families and for parents? What's on offer for parents?
Okay, so we have 2 levels of offering in the ESDM for parents. One, again, is a workshop series that's spread over 5 weeks. It's an hour and a half a week, and it covers the topics that are in the ESDM Parent Manual, which is a beautiful book that was written by Sally Rogers and Geraldine Dawson and Laurie Vismara for parents. So the teaching principles that I outlined earlier on in our talk are translated into different terminology for parents. So management of child attention in the parent model is called Step into the Spotlight. And dyadic engagement is called Takes Two to Tango, back and forth interaction. So it's written in that lovely parent-friendly way. And the workshop series essentially follows that manual. And again, there's a week between each session, so parents can try these things out with their children in the home. And it's very much a focus on building this ESDM into everyday routines, such as dinner time, bath time, getting dressed, going to bed. All of those times of the day can be turned into ESDM routines, rather than encouraging the parent to sit down in a closed room with a table and 2 chairs and do therapy. So this is the beautiful naturalistic part of this model and how it can be translated across multiple settings because of that. The other layer of the parent training is the parent ESDM coaching, where we invite a parent into our rooms and we coach the parent in how to deliver this therapy to their child while they're doing all the work with their child. That's something else that we have been and can do remotely, and going into their homes instead of bringing them into our clinics.
Amazing. So then it's reinforcing all of those principles again of the practice that we're trying to see. So we've had some wonderful feedback from families and recently had some amazing feedback about what was happening in one family. Can you tell us a little bit about that? Florence, our dear little Flo. And we have permission to talk about this particular
so this lovely family, Danielle, Florence's mum, and Florence came down from Kingscliff on the border of New South Wales and Queensland right at the beginning of this year for 12 weeks.
This year or last year?
Was it last year?
It was last year.
It was. They did. It was in June. Sorry. Yeah. Or October. I think it was October. It was October last year. And they came down.
Last year felt like this year.
I know. They came down to access 12 weeks of intensive early ESDM, early intervention in the form of ESDM. So they were accessing that intervention through Kids Uni Early Intervention Team, where all of the staff there are trained in the Early Start demo model. And they also came to my advanced workshop, which was a live workshop, the only live workshop I did since June last year on campus here. So Flo and Danielle came to that workshop, and Flo was the little one that we worked with. And she was 21 months old. So to have a child that young in a 3-day workshop was incredible, because everybody could see her progress from day 1 just to the end of day 3. And this is how quickly the model can work when it's done in the way that it's intended to be done. And then Flo's mum, Danielle, also joined the parent workshop and some parent coaching. And it has made the most enormous difference, not just to her child, who is now initiating social contact with her mum, games, sustaining eye contact, reaching up to ask her mum to play Ring-a-Ring-a-Rosie or Row, Row, Row Your Boat or one of those lovely games. And it's made an enormous difference to the whole family as well.
I think too what came through in the mum's description of what was happening was great delight that they were taking in their daughter's development and the changes, and being able to I suppose have an optimism about her and her happiness as well, which was lovely. It was a beautiful story.
It was a beautiful story. And when she arrived, she was quite despairing of this new diagnosis, but she left with enormous hope in her heart.
Beautiful.
And just of the successes that happened in a short 12 weeks.
Yeah, fantastic. Now, the model is evidence-informed, so it's important to stress that it has a very strong research foundation. I know there are many papers that have been written, and there's a great deal of research. Maybe if you could tell us about the research on sort of mainstream settings and how the model works in mainstream early childhood education settings.
Okay, so that was the 3-year research project that I mentioned earlier when I was talking about the educator training package, which we call One for the Team, because it is for the whole team. And that was in terms of, it followed up 2 previous studies that we did at the KU Marcia Burgess, ASOG in Sydney, where we first brought the model out to Australia back in 2009. And the first, as I said, was whether the ESDM does reduce maladaptive behaviour in children with ASD, and it did to a statistically significant level. Then the second study was a parent study asking parents what they wanted most for their child with ASD. And unanimously what they wanted most was for their child to be included with other children in community settings, and for their child to be able to learn from their typically developing peers. Right. So those 2 factors combined led to the mainstream study. Can we apply this model to a mainstream setting? We were very fortunate in the fact that we had 3 mainstream settings who put their hand up for this and were very happy and willing to go along, and 53 staff, which we trained. Now, it wasn't just reliant on that training process and those workshops. It was actually reliant on its success. We believe was reliant on the fact that following the workshops, we gave weekly guided practice to those centres.
Okay.
So one of our certified therapists would go out to the centre for a couple of hours a week to each of the centres and guide and mentor and coach the staff on the floor in the moment. And that was the most popular feature of the entire project to the staff. And, they would be looking forward to these people coming out each week, and they would have a list of questions for them. And they'd have their stories of success and the highlights of the week or the problems that they'd faced. So they were able to troubleshoot those together at the end of the guided practice session. But yes, it was very much about, it highlighted the need for a coaching and mentoring process following professional development.
Fantastic. So that's some of the research, but there is a great deal more, of course, that we could share. But that's been a fantastic introduction to the Early Start Denver model and the different elements of that. So thank you, Liz, and thanks for talking to me today.
Thank you for having me.